Hello everyone, welcome to the video on anticoagulants. As the name indicates, the agent which will inhibit coagulation process are known as anticoagulants. The coagulation cascade final product is thrombin. So the agents which will inhibit the thrombin are also known as anticoagulants. There are two types of agents are there. Direct thrombin inhibitors. So these agents will directly inhibit thrombin and coagulation is inhibited. The other class is known as indirect thrombin inhibitors. Now indirect thrombin inhibitors, they do not directly bind with thrombin, but they activate a protein called as antithrombin. Antithrombin is also present in our blood. When it is activated, it inhibits thrombin activation. Now understand the difference. Direct agents directly bind with thrombin and show their action. Indirect agents activate antithrombin. This antithrombin in turn inhibits thrombin function. So when you see the agents, we have these two agents are there. Along with that, factor 10A inhibitors are there. Now factor 10A is responsible for the formation of thrombin. So when you inhibit factor 10A, you are inhibiting thrombin formation. So thrombin inhibitors, factor 10A inhibitors, and finally vitamin K inhibitors. Vitamin K is responsible for the activation of factor 2, factor 7, factor 9 and factor 10. So when vitamin K is inhibited, all these factors will not be activated and coagulation process is inhibited. So we have three major classes are there: direct thrombin inhibitors, indirect thrombin inhibitors, vitamin K inhibitors. In this video, I will explain all these three agents, and this is my YouTube channel. If you like the video content, do subscribe and share. Let's get into the topic. So the agents, depending upon the route of administration, they can be classified as oral agents, parenteral agents. When you get down, they come down to vitamin K inhibitors, thrombin inhibitors, factor 10A inhibitors. So you have direct thrombin inhibitors are there, indirect thrombin inhibitors are there. So all of them can be pieced into three classes. One, thrombin inhibitors. Thrombin inhibitors, you have direct, indirect are there. Two, factor 10A inhibitors. And third one, vitamin K inhibitors. Let us see one by one. Let us start with vitamin K inhibitors. When you see in vitamin K inhibitors, the drugs are Warfarin, Dalteparin, Acenocoumarol, Phenindione. Now, the prototype drug is Warfarin. Warfarin is an oral anticoagulant that inhibits vitamin K, protein C and protein S. Now vitamin K exerts its effects through activating an enzyme called vitamin K epoxide reductase. Now the job of this form is to activate factor 2, 7, 9 and 10. Now along with that, warfarin also inhibits protein C and S. Now protein C has got anticoagulant activity. This is important. Protein C has got anticoagulant activity. Now, so these are administered orally for a long time to prevent clot formation. But the toxicity is related to bleeding. See, all anticoagulants, the major adverse effect is bleeding. Medication interactions are there. Warfarin binds with plasma proteins. So the drugs which will bind with plasma proteins, kinetic profile is changed with warfarin co-administration. It has shown teratogenicity and skin necrosis. The important factor is warfarin at the beginning it causes hypercoagulation because it is inhibiting protein C, which is an anticoagulant. So when that anticoagulant goes down, coagulation increases. That is what becomes hypercoagulation. Getting into the more details, it is used to prevent disorders caused by blood clots like deep venous thrombosis, which may result in pulmonary embolism, arrhythmiasis, atrial fibrillosis, stroke, prosthetic heart valves. Prosthetic heart valves may also activate coagulation, and myocardial infarction, which is responsible for heart attack. Now let us look about thrombin. So see, before understanding about thrombin inhibitors, let us understand the functions of thrombin. See, thrombin has got multiple procoagulative functions. The first one is it activates platelets. Second one, it forms fibrin. That is what is responsible for forming coagulation fibrin mass. Third one, it activates factors of coagulation cascade, especially 13A. 13 factor, when it is activated, it combines with calcium ions and forms cross links in the clot. That is what becomes a thrombus. So three major functions are there: activation of platelets, fibrin formation, and all these factors activation. Let us see the agent. Direct thrombin inhibitors. These agents directly binds with thrombin and inhibits thrombin function. Bivalirudin, Lepirudin, Argatroban, Hirudin, Dabigatrin. See, all of them, they are congeners of Hirudin. Hirudin is from leech. See, leech will suck our blood without causing coagulation because it is releasing a chemical called as Hirudin, and based on that, drugs like Bivalirudin, Lepirudin, Argatroban are developed. So they can be taken intravenously. Subcutaneous one is Hirudin, whereas Dabigatrin can be taken orally. These drugs are a kind of second line drugs to manage deep venous thrombosis and atrial fibrillation. See, deep venous thrombosis may cause pulmonary embolism, whereas atrial fibrillation results in strokes. The problem is the toxicity. GI symptoms like dyspepsia, gastritis may occur. Risk of bleeding is increased. A small fall may increase a lot of bleeding when it is taken in excess. The other class, factor 10A inhibitors, you can see the drugs Epixaban, Enoxaparin, Rivaroxaban. All of them has got this 10A is there. That is what is the hint for these drugs. All of them can be taken orally. Again, they are used to prevent deep venous thrombosis, atrial fibrillation. They are a very good alternative to warfarin. The reason is rapid onset of action, fewer drug interactions, and lab monitoring is not required. So these are the drugs which are factor 10A inhibitors. Moving further, now indirect thrombin inhibitors. Now indirect thrombin inhibitors. As I explained you, indirect thrombin inhibitors do not bind with thrombin directly. What they do is they activate antithrombin which is present in the blood. Now what is the function of this antithrombin? Antithrombin binds with thrombin, and what it does, it inhibits the conversion of activation of thrombin. Along with that, antithrombin also inhibits the activation of factors 7, 9, 10, 11, 12. So it inhibits certain factors, it inhibits the activation of thrombin. Now in this class, the prototype drug is heparin. Heparin contains a pentasaccharide chain with a long tail. So they belong to a class glycosaminoglycans. Now as such, heparin is known as unfractionated. As such, it is isolated from pig intestine epithelium, which contains the major source of heparin. These are also known as high molecular weight one because they have got a long tail. Long tail is nothing but this one. In certain drugs, the tail is reduced. They are called as low molecular weight heparins, like Enoxaparin, Dalteparin. So they are also known as fractionated because the size is reduced. Now let us understand the mechanism of action. Now heparin is also known as unfractionated or high molecular weight heparins. Now it has got this pentachain and a long tail is there. Now heparin, see, look at this, it binds with this antithrombin like this, and it inactivates thrombin. The antithrombin inactivates, it binds with thrombin and inactivates the activity of thrombin. This is what it does. So this is heparin, which activates antithrombin, which binds with thrombin and inactivates the function of thrombin. Not only that, factor 10A is also bound with this and inactivated. So heparin can inhibit factor 10A as well as thrombin. Both of them can get inhibited. Now, whereas low molecular weight heparins like Enoxaparin, Dalteparin, they can only inhibit factor 10A. How do they do it? They also activate antithrombin. That's why they are known as indirect agents. They also inhibit factor 10A. The last class, only pentasaccharide chain without the tail can also be used as anticoagulant. It also binds with antithrombin, activates and binds with factor 10A. The drug is Fondaparinaux. So all these agents can be used. So heparin, see, it reduces the activity of clotting factor, thrombin and 10A. Both of them are inhibited. Whereas remaining drugs, unfractionated and fractionated, low molecular drugs, see, heparin belongs to this unfractionated class, whereas fractionated one, they only inhibits factor 10A. Now the major adverse effects are risk of bleeding, heparin-induced thrombocytopenia. This is a biggest problem with heparins. Now the next one, osteoporosis. Bones may get brittled. Now see, all these drugs can be used for short-term immediate anticoagulation activity. They are used to treat acute pulmonary embolism, deep venous thrombosis and surgical prophylaxis. Low molecular weight one like Enoxaparin, Dalteparin, they have better bioavailability when compared to unfractionated heparin. Half-life is also longer. They do not require laboratory monitoring. Fondaparinaux, as we have seen, it has got only pentapeptide chain which will inhibit factor 10A. So these are all anticoagulants. So thank you for watching this video. If you like the video content, do subscribe and share.